Welcome. Today we're diving into a parasitic disease that significantly impacts global health, especially in tropical and subtropical regions, bladder schistosomiasis. Join us as we explore its causes, effects, diagnosis, treatment, and how we can prevent its spread. Bladder schistosomiasis, also known as urinary schistosomiasis or bilharzia, is caused by parasitic worms called Schistosoma hamatobium. These worms are found in freshwater snails, acting as intermediate hosts. Humans become infected when they come into contact with water contaminated with these parasite-carrying snails. Simply swimming, bathing, or washing in such water can lead to infection. Once the schistosoma larvae, called cercoria, penetrate human skin, they transform into schistosomulae. These travel through the bloodstream to the liver, where they mature into adult worms. The adult worms then migrate to the veins surrounding the bladder. Here, the female worms lay eggs, which penetrate the bladder wall and are excreted in urine. This egg-laying process causes inflammation and damage to the bladder lining, leading to various symptoms and potential complications. Some eggs may become trapped in the bladder wall, leading to further granuloma formation and fibrosis. Bladder schistosomiasis is prevalent in sub-Saharan Africa, particularly along the Nile River Valley, as well as parts of the Middle East. It's a disease closely linked to poor sanitation and limited access to clean water. Children are especially vulnerable because they often swim and play in contaminated water. Understanding the geographical distribution of Schistosoma hamatobium is crucial for targeted prevention and control programs. The symptoms of bladder schistosomiasis can vary depending on the severity and duration of the infection. One of the most common signs is hematuria, or blood in the urine. Individuals may also experience painful urination, frequent urination, and abdominal pain. In chronic cases, the infection can lead to more serious complications, such as bladder cancer, hydronephrosis, swelling of the kidneys due to urine backup, and impaired kidney function. Diagnosing bladder schistosomiasis typically involves detecting Schistosoma hamatobium eggs in urine samples. Microscopic examination of urine is the most common method. Other diagnostic tools include urine dipstick tests for blood, ultrasound imaging to assess bladder and kidney damage, and sometimes bladder biopsies to examine the bladder tissue directly for the presence of eggs and signs of inflammation. While there aren't distinct classifications or types of bladder schistosomiasis based on the parasite itself, the disease is often categorized based on the severity of infection and the extent of bladder and kidney damage. Infections can be described as mild, moderate, or severe, depending on egg counts and the presence of complications like bladder wall thickening or hydronephrosis. The primary treatment for bladder schistosomiasis is the drug praziquantel. It's highly effective in killing adult schistosoma worms. A single dose is usually sufficient, but in some cases a second dose may be needed. In addition to praziquantel, management of the disease may involve treating secondary bacterial infections and managing complications such as bladder obstruction or kidney damage. Regular follow-up is essential to monitor for recurrence or the development of long-term complications. Preventing bladder schistosomiasis relies on a multi-pronged approach. Improving sanitation and providing access to clean water are crucial to reduce exposure to contaminated water. Health education programs that teach people about the disease and how to avoid infection are also vital. Mass drug administration programs using praziquantel can help to reduce the parasite load in affected communities. Snail control measures, such as the use of molluscicides in water sources, can also play a role in interrupting the parasite's life cycle. The prognosis for bladder schistosomiasis is generally good, especially with early diagnosis and treatment. However, chronic infections can lead to irreversible damage to the bladder and kidneys. Recent research is focusing on developing new diagnostic tools, improving treatment strategies, and understanding the long-term impact of the disease. Scientists are also exploring the potential of vaccines to prevent schistosomiasis infection. Continued research is essential to eliminate this neglected tropical disease and improve the health of affected populations.